Have you ever felt like your body just suddenly changed? And I mean changed for the worst. And nobody could really explain why to you. Maybe what happened is that your joints started hurting, your sleep changed, you just didn't feel resilient at all. In fact, your body feels inflamed. Your energy spikes, crashes, isn't consistent. Your nervous system feels a bit reactive, not responsive. And maybe something crazy like a frozen shoulder happened seemingly out of nowhere. And yet, if you looked at your blood lab work, everything appears to be normal. Well, today I want to talk to you about something called oxidative stress and why I believe it's one of the missing links connecting hormones, inflammation, pain, metabolism, and the nervous system, especially for women in perimenopause and post-menopause. Hi, I'm Dr. Jodi Medell. I'm an integrative health and functional medicine practitioner. I have a doctorate in physical therapy, and I am the founder of the Healing Continuum Method. It's a 5-step method that focuses on helping women regulate, repair, restore, rewire, and reclaim their health through whole body analysis. Because the body isn't just one system. It's an interconnected network of systems. So, what is oxidative stress? I'm going to break it down and make it really simple. Every day, your body produces energy. And that process creates unstable molecules, and those molecules are called free radicals. Normally, your body is able to neutralize those free radicals with using antioxidants. But when the system becomes overwhelmed, and it can become overwhelmed through stress, inflammation, poor sleep, overtraining, hormone changes, environmental toxins, blood sugar instability, emotional stress, chronic illness, when those things affect the body begins to take on excessive damage, and it can't then repair the free radicals. This imbalance is called oxidative stress. And you can almost think about it as this internal rusting that's going on within your system. And over time, it affects everything. And what I mean by everything are your hormones, your mitochondria, your joints, your brain function, your sleep, your metabolism, your immune regulation, your recovery, and your nervous system resilience. And why does this matter for somebody who's over the age of 40, specifically women who are perimenopause and postmenopausal? One of the things not discussed enough is that estrogen actually is a very protective hormone, and it has protective effects on the body. So it helps regulate inflammation, it supports the brain, it supports healthy mitochondrial function, and it helps protect tissues from oxidative damage. So as estrogen begins to fluctuate and decline during perimenopause and postmenopause, many women suddenly feel more inflamed, tendon pain in the joints, maybe something like a frozen shoulder, sleep disruption, brain fog, increased anxiety, a slower recovery from activity, stress, your workouts, weight changes, and nervous system dysregulation. And then what happens is you often think, what happened to me? Nothing's broken. I want to say that one more time, nothing's broken, but the body is simply losing its resilience. An example of this, I heard a story, I was listening to a podcast, and this woman was being treated for a frozen shoulder. She was in her late 40s. And she went to see a new physician because the therapy for her frozen shoulder was a cortisone injection, physical therapy, movement, manual therapy. And she really didn't want to go through with the cortisone injection because she didn't want to have the tissue degradation that occurs with it over time, and she wanted to be more natural in her approach. So she sought out a new practitioner, and this practitioner question what's going on with her physiology. And it turns out that this woman was perimenopausal, had other signs and symptoms in her body showing systemic inflammation and oxidative stress. So instead of a cortisone injection, this woman was treated with manual therapy, but on the other side of things, from her PCP, she was given hormones, HRT, inflammation pathway restoration, supplements to treat her antioxidant system, and she also was taught nervous system regulation techniques. And over the course of several months, not only did her shoulder improve, she felt a whole lot better. So she got a twofer. Not only did she address her frozen shoulder, but the reality was her frozen shoulder was the end result of things that were going on within her physiology. So once her physiology was addressed, then it reduced the frozen shoulder. So that is the key difference between symptom management, which would be just getting a cortisone injection and treating the frozen shoulder with physical therapy, versus systems thinking, looking at how physiology affects overall function. So this is exactly why I created the Healing Continuum Method, because healing is rarely linear, and the body doesn't separate itself into individual parts. Structure affects physiology. Physiology affects the nervous system, and the nervous system affects hormones and inflammation. And we can also do this in reverse. Hormones and inflammation affect the nervous system affects physiology, and physiology affects structure. So everything is interconnected. So my work focuses on that interconnectivity. And it's a 5-step program looking at regulating the system, restoring the physiology, repairing the structure, rewiring the nervous system, and ultimately reclaiming a connection to health and well-being. So this is not through fear, this is not through biohacking extremes, and it's not through another horrible diet regime program, right? This is about understanding the body differently, having a dialogue with the body. So, how do we actually support oxidative stress? This is where lifestyle becomes medicine. And some of the biggest foundations include regulating your sleep, regulating your blood sugar, making sure your protein intake is adequate, completing a strength training program that's focused, recovering from stress from your workouts, regulating your stress, following an anti-inflammatory way of eating, doing the deep dive into nervous system trauma work, and giving your mitochondria support. And sometimes we use targeted supplementation, and that can include things like magnesium, omega-3, NAC, glutathione support, vitamin D, minerals, and polyphenols, and more. But supplements are not magic. The body really ultimately needs safety and regulation in order to heal. And honestly, I think most of you probably already know this. You know that your body's asking for a different relationship. It's not asking for punishment. It's not asking for you to work harder, be faster, get more motivated, mind over matter. And it's not looking for another extreme of anything, but it's looking for a deep level support, a different relationship. Your body really wants to be seen and heard and loved, acknowledged. And so it's asking for you to tune in, listen in, and understand at a deeper level. And that's really what the Healing Continuum and the Healing Continuum Method is all about. So if this resonated with you, I'd love for you to subscribe to the channel. I'll be sharing more about hormones, inflammation, nervous system regulation, functional medicine, movement, recovery, women's health, and what true healing actually looks like when we address healing from a multi-systems, interactive, interconnected approach. Thank you. Have a great day.